Hello, everybody. My name is Dr. Lakshmi Gorugantula. I'm an oral medicine specialist and an oral and maxillofacial radiologist working at North Dallas Dental Health in downtown Dallas, Texas. So today I'm going to talk about what I see in my practice as an oral medicine specialist. Oral medicine is a specialty in the field of dentistry. It is like a bridge between the fields of dentistry and medicine because oral medicine has all these conditions that fall under the bracket that are more medical conditions happening in the mouth and also in the head and neck area. So if we divide all the conditions that actually normally see in the practice, they can be the mucosal conditions which impact the soft tissue structures in the mouth and the head and neck area. And also there are pain conditions and there is also sleep apnea and breathing disorder. So today I'm going to talk about more of the common pain conditions that happen in the mouth and also in the head and neck area. So the most common thing that often patients complain about is symptoms associated with a joint in the face, which is called the temporomandibular joint, TMJ. So we all have this joint in our face, which is a joint between the temporal bone of the skull, condylar process of the mandible, which is called the temporomandibular joint. Similar to any other joint in the body, mandibular bone, there is a cartilage component, which is also called articular disc, which is present within the joint space itself between the two osseous components, and there are muscles of mastication that are present in and around the joint that help with its stability and uniform function such as opening, closing, chewing, talking, and such. So oftentimes, patients present with most common symptoms such as they feel pain in the joint itself, they feel pain in the face itself, face feels tired when they wake up in the morning, and they don't know why. Patients also complain of headaches because even though they had good sleep, they often wake up in the morning with headaches. Inability to open mouth wider, inability to eat a big burger that they used to eat comfortably before, possible changes in the occlusion, and also there is pain without doing anything at rest or with functions such as eating, chewing, swallowing, yawning, and such. And patients also often complain about clicking and popping sounds when they try to open their mouth, eat something which is on the tougher side, or eat something that are like baby carrots or nuts and such. So these are the most common symptoms. Not only that, patients often complain about pain in the ears. Because of the very close proximity of the temporomandibular joint to the ear structures, they often feel like there is ringing in the ears, congestion in the ears, pain in the ear itself. So they often go to ENT doctors multiple times and they have all the workups done and with no significant findings found with ear abnormality. So these are all the most common conditions that can impact either the osseous component of the TMJ or the disc component of the TMJ or the muscular component of the TMJ. So all these conditions come under the bracket of temporomandibular joint dysfunction, TMD, or myofascial pain and dysfunction syndrome, MPT, MPTS. This is one of the most common pain condition in the head and neck area that I see very frequently. And they often see mild changes in the occlusion such that there's mild open bite posteriorly. They're not able to eat and chew comfortably, especially the salads. They're not able to bite all the way down and they don't know why. So this is one of the most common conditions I see in the practice. These are called neuralgias. Because of the multiple cranial nerve involvement in the region, we often see trigeminal neuralgia, auriculotemporal neuralgia, occipital neuralgia, glossopharyngeal neuralgia, only to name a few, and there are even more than these four. Depending upon the location of the nerve, patients often complain about classic neuralgia kind of pain, which is sharp, intense electric shock-like pain, which is pretty intense and could be debilitating for the patients too. So based on the location, the trigeminal neuralgia happens along the three branches of the trigeminal nerve, which is the orbital V1, maxillary V2, and the mandibular V3. So if they often have pain along either the outside involving the skin and the muscular structures or along the inside the mouth, involving the maxillary dentoalveolar structures. In case of auriculotemporal neuralgia, patients often complain of intense, sharp electric shock-like signal and pain in the TMJ area because of the close proximity of the auriculotemporal nerve to the TMJ area and the ear structures. And occipital neuralgia is along the base of the neck and in the neck region. They often complain about not only the pain in the neck area, but they also complain about pain that goes traveling to the head and causing headaches too. So patients often complain about this sharp, intense pain, especially when they're drinking something, chewing something, swallowing something, even talking. Any kind of movement can provoke this kind of pain. The most common symptoms would include episodic. These episodes of pain, they are very short-acting, short-lasting when the condition starts initially. Intense 10-on-10 pain that comes and goes. You don't know which activity could trigger this kind of pain, can come just on its own without any provocation too. However, if this condition is not treated or managed in the beginning stages, the intensity of the pain can get even more intense with time. The duration that it lasts will get longer, and also there are more number of episodes that happen almost to a stage where the pain becomes continuous. But this is a very classic neuralgia kind of pain that we often see in the head and neck area and also in the mouth. A little variation of the neuralgias is neuropathy. So it is slightly different from the classical neuralgia, especially we see neuropathic pain in the mouth, in the dentoalveolar structures, with a little bit of history in the past of either an extraction or a pathology that was removed surgically and surgical intervention in the area, orthognathic surgeries, osseous surgeries, genioplasties, even implant surgeries, even endodontic therapy. Sometimes I've seen patients with this deep, constant, deep pain that's not in the tooth, but they feel like the pain is deep in the tissue, deep in the bone. Even after a scaling and root planing procedure, neuropathy is in a slightly variation of a neuralgia pain. And the difference is this kind of pain is deep, and it is decently intense, moderate to moderately intense, and it's pretty much constant all the time. And neuropathies can also be associated with altered nerve sensations such as allodynia, paresthesia, or even numbness anesthesia. So we see these things quite often in the mouth. The other most common chronic pain condition that I see is a little bit of variation of muscular pain, such as fibromyalgia, chronic fatigue syndrome, myalgia in the neck muscles, but they are not just pain in the neck, literally, but the pain can be felt in the facial structures too. So these pain conditions are called cervicalgia and cervicogenic pain. Cervicalgia is a pain which is involving the muscles in the neck region, whereas in cervicogenic pain, even the origin is in the neck, but the pain can be felt in the other parts of the head and neck region, which is like a referred pain. So for example, here, the biggest muscle in the neck region is the trapezius muscle. Because it is a big muscle, because of the distribution of the forces, sometimes patients can have trigger points distributed along the course of the muscle, like superior part of the muscle, middle part of the muscle, or even inferior aspect of the muscle. So trigger point are the points where there is more of the tension that gets accumulated within the muscle itself, and they can be active trigger points or passive. Active trigger points cause pain even at rest without doing any kind of function. However, passive trigger points can elicit pain only with function, and also they can cause a little bit of disharmony in the muscle behavior itself. For example, if the trigger point is present along the upper aspect of the trapezius muscle, patients not only feel the pain in the neck, which is the cervicalgia, but the pain can be referred to the areas in the head and neck region itself, to behind the ear, into the occipital area, to the frontal area, all this causing different types of headaches. And also patients would feel pain in the jaw. So this kind of pain pathway is called cervicogenic pain. So when patients complain of pain in the face, we just not have to think about what are the conditions that can cause in that area only, but we also have to think globally to what other conditions could cause this referred pain to the facial region. So the other conditions that we often see in our practice are headaches. A lot of times, the most common cause of the headaches that I see in my practice are muscle related, more like tension type of the headaches, or even different trigger points located in the muscles of mastication presenting as headaches too. So the most common one is one of the biggest muscles of mastication, which is the temporalis. The temporalis is like a fan-shaped muscle extending along the temporal aspect of the bone. So based on where the location of the trigger point is, it can not only have pain referred to the maxillary dentoalveolar structures, but a lot of times pain can go into the head region, causing and presenting as headaches too. The classic presentation of tension type of headaches is you feel like there is tight band around the head, like a U-shaped band, and you feel the tightness causing the constant throbbing kind of headache in the head. So we deal with a lot of muscular-related chronic pain conditions, and we have different treatment modalities that we can offer to the patients to help manage their symptoms.